My particular research interests are topics that span the continuum of critical illness, so not just topics that are based in the emergency department or the intensive care unit, but topics that span that patient care journey across those two departments. My name's Shane George. I'm a Paediatric Emergency physician and Paediatric Intensive Care physician here at Gold Coast University Hospital in Queensland, Australia. I work clinically in both the emergency department and the Paediatric Intensive Care unit, predominantly looking after children and have a special interest in paediatric critical care. My career started off in emergency medicine and I developed a keen interest in paediatric emergency medicine initially, which developed into paediatric critical care. I was fortunate enough to work in a hospital that allowed me to work in both the emergency department and intensive care unit, which really focused me on that acute spectrum of illness in children. My research career started through involvement in the PREDICT network, collaborating on some multi-site studies, moving forward into developing my own ideas and own questions with the support of the PREDICT network and some senior researchers to guide that process, culminating in the completion of my PhD this year, which was focused on a study that looked at improving outcomes in paediatric intubation. My particular research interests are topics that span the continuum of critical illness, so not just topics that are based in the emergency department or the intensive care unit, but topics that span that patient care journey across those two departments. So in particular, topics such as intubation, sepsis, diagnosis and management, major bleeding and haemorrhage, so looking at better ways that we can manage major bleeding in children, that are important not just at one point in time in that ED or ICU journey, but important over the entire critical care journey. My research has been funded by multiple different organisations. The Emergency Medicine Foundation has been very generous in their support of particularly Queensland emergency researchers, providing significant seed funding to allow development of projects and then developing those into funding for larger organisations. I've received funding from the National Health and Medical Research Council as well as the Medical Research Future Fund for a number of multi-site projects, as well as the Thrasher Research Foundation in the United States, which funds paediatric research focused on clinical outcomes for children. The passion comes from seeing the outcomes that we get for children and their families. Working with critically ill children is both challenging and rewarding at the same time. You develop a real bond with these families as they go through what is the worst time of their life as they're caring for their critically ill child, and opportunities to smooth that journey out for them or provide an intervention which makes a significant difference to their long-term outcome, I find really rewarding. The families that we work with are also appreciative of any work that we do to try and improve outcomes, not only for their own child, but also for potentially other children that are suffering from similar illnesses. The generosity of families in participating with this sort of research really is astounding to me, the generosity that they display, and some of that drives my passion to continue along my research journey. Outside of work, I enjoy ocean swimming as my predominant hobby. I've got 3 active kids who are all in nippers and various beachside activities, so I found myself swimming a lot trying to keep up with them and developed a passion for ocean swimming, so I swim a couple of times a week with a group that swims along the Gold Coast.